Hi, Greg.
Hey.
How are you?
Doing good, how are you?
Good. Good to see you.
Yeah, good to see you again.
All right. Let me just pull up your chart really quick. All right. So it looks like you're here for some anxiety. What's going on?
I don't know. I've just been finding myself losing sleep and ruminating and a lot lately.
Hey, Dr. Lister.
Hey.
Give a second.
Sure.
So I have this patient. He's in room 2. He's a 25-year-old guy. I've seen him for, just like sports med stuff. But he's here today because he's more anxious in the last 6 weeks. His GAD-7 is like really high. He also is having a lot of depressive symptoms as well. No suicidal ideation or anything like that, but mostly just really anxious about his girlfriend, and she thinks she's like wants to break up with him, and it's really affecting his work and sleep and all these things. So he was initially requesting medication, but I think is really open to therapy as well, which honestly I think is a better fit for him at this time. So he was open to letting you come in and talk to him, and I was hoping you guys can talk, see what would be best for him, and then we can go from there.
Sure, yeah, go and maybe I can consult with him and see where we can go.
Yeah.
And then I'll come back and check in with you.
Cool. Sounds great. Thanks.
Okay, so I had a chance to talk with Greg.
Yeah.
And definitely, pretty anxious about his relationship. And so what I did with him was I kind of sat down with him and went through the way that our mind impacts the way that we feel and anxiety. And I actually went over a cognitive thought log with him. So I went through kind of cognitive distortions, and then I actually walked him through one of the scenarios with the thought log, and that actually was very helpful for him.
Okay.
So his anxiety went down from 90 all the way down to 30.
Oh, that's great.
So yeah, so I think that'd be great. So I asked him whether or not he still wanted to talk with you about pursuing a medication. Now medication, he says maybe he'll hold off a little bit, which I think would be a good thing.
I think so too.
And then check back maybe in a month or so to see how he's doing.
Okay.
And then go from there.
So are you guys going to meet for therapy?
So right now it seems like just going through this exercise was very helpful for him. I will give him a follow-up phone call next week to kind of see where he is, and then from there maybe do another phone check-in before your next appointment with him.
Okay, perfect.
And then go from there.
Sounds good. Thank you.